guys, welcome back to my YouTube channel. So today I thought I would do a little video talking about nursing, talking about the good and the bad, and kind of what to expect really. So nursing is like a huge topic in general, so I might have to make this into a few videos. And also if you have any questions, then just drop them below. I might do like a little Q&A in terms of nursing. So let me know if you do have anything or any suggestions, and I'll be sure to check them out. One of the most positive aspects that I find of nursing is that it is the most rewarding job you could ever do, and I've had many jobs. Again, I can probably go into that at some point in terms of how I got to nursing, but I can honestly say that nursing is the most rewarding job that I've done. You share a personal connection with someone, and you really do impact their life. You are literally saving someone's life, whether it's just that you're talking to someone, or whether it's that you're actually helping facilitate a procedure, or you're doing a procedure yourself of some sort, or you're physically doing something to impact their life. It's an extremely rewarding job, and I don't think there's anything out there like it at all. You also connect with someone on such an emotional level, obviously maintaining professionalism, but you definitely connect with people on a different level that you possibly wouldn't in any other job role, or that I've witnessed anyway. Most of the time, now this is something that can be in positive and negative, but most of the time I do find that you are in a very supported network of like-minded people, and especially if you're someone that works on the ward, or if you work in a permanent role, you will find that your workmates become like your family. And I think you do kind of get this in most job roles that you are in, especially as, most people spend more time at work than they do with their own families, but your work colleagues definitely do become family. And you will have people there that you don't get along with, but you will have a lot of people that you will get along with. And usually I think most people support each other, and if you find a good ward, stick with it, because it will change from ward to ward, and there are going to be ups and downs in nursing. Honestly, I think nursing is a huge emotional roller coaster, and you have several ups and downs, and that could be a day. You could have so many ups and downs in one day, or you could just have a smooth sailing day and have just a couple of ups and downs in a month. But it's definitely a roller coaster of a job, I think. So be prepared for that if you are someone that is looking at going into nursing. But it is a great job to be doing. You are constantly learning. It's never endless learning within this job. There's always new devices, there's new research, there's new ways of facilitating something. There's also, you're constantly adapting your own styles, you're constantly adapting your own time management, you're adapting as a person, you're learning, maybe managerial roles, you are also adapting to your patients as well, and adapting to different personalities, adapting to different people's styles of working. So you're constantly learning. You're not just physically learning, academic anatomy and physiology, or learning drug calculations or different drugs and how they can interact with one another. You are also learning about people and learning life interpersonal skills that can take you anywhere really, which is great. So it's never endless learning. And if you speak to a nurse that has worked for 30 years, they will say that they will learn something new every day, and it's very true. You do learn something new all the time, and you can never really know too much. Nursing can take you anywhere. There are endless opportunities for progression, for growth, for new challenges, traveling the world. There are so many job roles within nursing, and so many different aspects as well. You know, you've got working for the NHS, you've got working for the private sector, you've got working in community services, you've got people need nurses for cruise ships, people need nurses for private families, people need nurses abroad. You can do so many things. You can go into research nursing, you can be a district nurse, going to people's houses and helping facilitate maybe wound care management or talking services. There's paediatric nurses, which are children nurses. There's adult nursing. There is mental health nursing. Honestly, your career potentials are endless, and you can pick and choose what you want as you want to. You can gain so much knowledge in one area, and you can take a lot of that knowledge and apply it to another area and also learn something new at the same time. So you will never be bored, because there is always something that you can do. And also, depending on where you are, you might find that every day is completely different. And I found that even though when I was working on the cardiology department, I did find that most days were different. Yes, you can get into a routine of knowing what the schedule is like and knowing what type of patients you're potentially going to be getting. But each patient does bring something new to the table. Each patient has a different profile from the last patient or from the other patient that you're working with. Not one book fits all. That's not the saying. What's the saying? Not one... Oh, what's that saying? Not one book fits all. That's not the saying. I don't know what the saying is, but one shoe? Not one... Oh, I genuinely don't know the saying. Okay, but each person has a different profile. You are never going to meet two people that have the same profile. Never. And if you do, then please hold me to that, because I don't think that that's possible. I don't think that that's possible. But if you do, then please hold me to that. Often you don't actually get people with the same name, same birthday, which can be very tricky when you're in hospital. But you will never have someone with the same profile as someone else in terms of illnesses, you know, their medical history, their heritage. You're not going to have that. So each person you meet does bring something different to the table, and you're faced with a different challenge with each person, which is great because it's exciting. Yes, it's nerve-wracking. You have the potential to go very, very, very wrong in nursing, very wrong. But it's also exciting because you're faced with different things on a daily basis, so that's great. So some of the downsides to nursing. Now, they're downsides, but there are positives to them as well. So as a job role, it can be extremely, extremely demanding to the point where, I mean, often when you're on the ward, you're doing 12.5-hour shifts. So you could be working from 7:30 in the morning until 8 at night. And that's a long shift, okay? That's a long shift. Sometimes it will go so quickly that you will think you've just done 4 hours. And other days, it might be feeling like it's a long day. Even if you've got loads to do, it might feel like it's a long day. And it really, really varies. I don't know why, but it does. So 12.5-hour days are long days. And if you've worked 2 days in a row or 3 days in a row, it's tough. It can be tough on your body, and it can be tough mentally. So one thing that I would say to kind of try and cope with that is make sure you take your breaks. Now, nurses are renowned for not taking their breaks. and it's so, so, so important. Please take your break. Please do that, because you need to have some time for you. You need to have some food. You need to fuel up, and it's good to take that step back and have some time for yourself. Go in with a fresh pair of eyes, and honestly, you will be able to work so much better. So do that for yourself, but also do that for your patients, because it's really important that you do that. So your shifts are 12 and a half hours long, but often you'll find that some people will stay behind a lot longer. I was actually quite lucky with my time management, and I think this is because of my previous experience in my job roles that I've done, but I was quite lucky that I would get out pretty much like maybe 10 minutes or 15 minutes after my shift, whereas a lot of people would be there maybe sometimes even like an hour and a half after their shift, which I think is absolutely crazy, because it's already 12 and a half hour shift, and then you're staying behind, and this is usually because of so many time constraints that are, I know you're looking after so many people, and also you've got to complete your notes. And often I think what people do is people not necessarily leave their notes till the end, but I think, say if you've got a patient that's coming in from theatre, or you've got a patient that you've got a new admission, it can really impact your day. Like events occur all the time within nursing, so your day, you can't predict your day. You can't really, as much as you can plan your day, you've got to also be prepared that that's going to really, really, really change, and every day is going to be different. So sometimes people might get out a lot later. Fortunately, I was quite lucky, and I just made sure that I was doing my notes. Any point that I could just quickly sit down and do some notes, I would do that. And yeah, I think as someone going into nursing, or if you're just newly qualified, I would really highly suggest you trying to do your notes as you go along. I like to follow the A to E assessment, so I can go into that in further detail. But if any of you don't know about that, then you can just leave me a message and I can reply to you, or I'll go into it in another video, because as I said, nursing is complex. But I think if you follow quite a strategic plan with your notes, and you kind of do that for each person, then you can't really go wrong. And honestly, just bang them out, do them when you can. And yeah, occasionally I would sometimes do notes on my lunch, which I wouldn't recommend doing. But I was someone who I'd prefer to do my notes on my lunch than have to stay behind at the end. So often what I would do is maybe have maybe half of my lunch to like eating and resting, and then the other half I would quickly do some notes, and then I'd get back out onto the floor. So yeah, timing is something to just be mindful of. Okay, so work-life balance can be heavily affected. I would say this is something dependent on where you're working. So if you're someone that's working on a ward and you're doing shift work, you might find that your social life or work-life balance might be affected. This is because you might be working nights, you might be working days, you might be working weekends. So there's a lot of flexibility there in terms of when your shifts can be. And often, I mean, it's going to be different in every hospital, but in the hospital that I work at, often you wouldn't do 3 nights in a row. You could potentially do 3 days in a row, but you wouldn't ever do 3 nights in a row. But you would then find that you could be working 2 days in a row, have 1 day off, and then you could be working 1 night. You could then have 1 day off and then be working another night. Your patterns can change so much, and that can, one, really affect your lifestyle, and also your sleeping pattern. Oh my goodness, I remember sometimes just trying to function after a night shift, trying to get myself back into a cycle, it was quite difficult. And that's something to bear in mind, that you've got to be prepared for a bit of a shift of your social life. It's not to say that you're not going to have a social life, because you will, but you just have to kind of manage it a little bit better. And yeah, that's not the case for everywhere. If you're working in outpatients, often you'll probably do 9 till 5, Monday to Friday. So then you've got your weekends free to see your friends or catch up with family. And that is more structured. But if you are doing ward work and it's shift work, then yeah, you're going to find that you are going to have a little bit of an imbalance to begin with, but you will probably find that you can adjust it quite quickly. And there is a lot of perks to having days off in the week. Honestly, shops are so much quieter. If you want to go shopping, if you need to get things done, then yeah, actually shopping during the week is a lot nicer than shopping on a weekend. So there's definitely some perks to doing it. And also, if you do shift work, you often kind of do 3 days or 4 days a week, so you do have some nice time off. And sometimes, if you're very lucky and the person who's doing the rotas knows how to manage it quite well, you can end up having like 4 days off, which is amazing. You can have like a little road trip somewhere, which is great. Nursing is not glamorous at all. The uniform is not sexy. However much people might joke about it, the uniform is not sexy. It will never be sexy. There's nothing sexy about nursing. Okay, I can tell you that right now. Yeah, the uniform is not nice, okay? So it's not these short dresses with the little hats and a nice belt, nothing like that. It's nothing like these Halloween dresses that people get. I just put pen, I'm flying pen around. It's nothing like that. So you often, maybe I'll try and dig out a picture of me in my uniform, or maybe I'll just grab my uniform and show you. But some people wear tunic and trousers. Some people wear dresses. And some people wear scrubs depending on your area that you're working within. Now, scrubs are the most comfiest clothes. So if you can be somewhere in scrubs, I highly recommend it, because they are so comfortable. You feel like you're in pajamas all day. And quite frankly, who doesn't want to be in pajamas all day? But the nursing uniform is not sexy, and yeah, you kind of don't want it to be sexy though, for many reasons. You will get bodily fluids over you at some point in your career, more than once, on, yeah, many occasions. And be prepared for that. All different types. Yes, that's all I'm gonna say. A big thing with nursing that's difficult is seeing death. You will see death and you might see life, and it's difficult. It's difficult. I'm not going to lie. It is difficult. Each death that you come across is going to be different as well. And that's in life and in nursing, in your career. Now, sometimes the deaths might be expected, sometimes they might be unexpected. They can be quite traumatizing, and they can also be quite peaceful. So it's very different for each person and each case, but you will see death, but you will be okay. As a nurse, you see things that no one else sees. As a nurse, you are exposed to things that no one else is exposed to, and you do see things that you shouldn't see, you know. And yeah, it is hard, and seeing that first death is difficult. It might not be your patient, or it might be your patient, but having that first experience is really difficult. One thing that I would recommend, if you are someone who knows that you want to be a nurse in the future, or you know, you're at college right now, or you're training in university, I would say that getting some sort of experience working with patients, whether you try and do some healthcare experience, or you work in a nursing home for a little bit, I do think that having that experience will help you, because you might come across death before you actually become a nurse, or before you start your nursing degree. And that actually did happen with me. I actually worked in a nursing home for a little bit, and I love old people. I love the elderly. They are absolutely brilliant. Some of them are so funny. They have so many stories to tell. Some of them have dementia, and sometimes it keeps you going, and sometimes you just think, how can I help? Like, what can I do right now? But sometimes it's entertaining talking to them. But I actually came across my first death there when I was working as a nurse, working as an assistant in a nursing home. And yeah, I'll never forget that. And to be honest, a lot of the patients that I've come across that have died, I don't think I've forgotten anyone, because they're all different and they all hold something with you. Yeah, it's odd. It's odd seeing death, but we deal with it. And, you know, if you are in a good place with some good workers around you, everyone's very supportive. And also take that time out, because you need time to have to yourself. That's important. Something that you might come across when you are nursing is doing something called last offices, and that is also to do with death, where you will clean the body. And that can be extremely difficult. If that's your first time doing it, make sure that you're with someone that is a very supportive nurse, or make sure you talk to your friends about it as well. One thing that I would say, if you're in your nursing degree, you're a student nurse at the moment, utilise your student nurse friends, because talk about your experiences. That is going to be the best thing to help you when you come across difficult situations like this, or sensitive subjects, and deal with those emotions as well. There'll be a great support network for you. And then lastly, something about nursing that I think can be a little bit negative is that it is an emotional roller coaster. So one minute you can feel very overwhelmed, the next minute you can be really happy, the next minute you can be crying in a cupboard. And yeah, things will go wrong and things will go right, but you have to take the ups and the downs, and just take a couple of moments to compose your thoughts and gather your information, write things down, make yourself to-do lists. They are the best things for you. Write yourself a to-do list for each patient, but definitely seek advice from other nurses, whether they're senior nurses or newly qualified nurses or senior practitioners or specialist nurses or even doctors. If someone has something to tell you, listen to that, whether it's a patient or whether it's a staff member. Just listen. It's one of the most important things that we can do in this world, is listening to somebody, because you can do so much with that information, whether it's something to help you, whether it's something to help them. So yeah, just take the time to listen to somebody. Okay, so I feel like I've gone over some positives and some negatives about nursing in general. I'll make a video on a few of the topics as well with nursing, because I feel like it's just so complex and there's so much to it, and so much I kind of want to just give you so much information about nursing in general. And also I will go into aesthetic nursing. It's going to be quite a big, good video, that one. So yeah, please keep watching for that. But anyway, thank you guys for watching, and come back next week. I'll have another video for you. If you have any questions regarding nursing, then pop them below and I will be sure to check them out. I will possibly do a Q&A at some point soon as well, just answering some questions that people have. So if you can give me a like and subscribe, that would be great. And thank you so much for watching. Bye guys.